Tonight, another Chris 6 News exclusive. When you have a major surgery, anesthesia is what puts you to sleep and keeps you from feeling pain. It's common, but also risky. Recently, Spohn Hospital cut ties with a local anesthesia group in favor of one with no track record or even a working website. Chief Investigative Reporter Rick Spohn has this report.
While a couple of dozen local physicians and nurses look for new jobs, we've had a hard time finding anyone who's ever heard of the so-called national group that Spohn picked to replace them. Anesthesia is not something anyone should take for granted, and any doctor knows that.
With the drugs we use, you could kill a healthy person within minutes.
For years, Spohn trusted Gulf Shore Anesthesia with this critically important task. Gulf Shore is a local group with about 30 doctors and 15 certified registered nurse anesthetists, or CRNAs. But now this, an internal memo from Spohn President Justin Doss announcing a company called Emergence is taking over anesthesia services. The memo claims Emergence is a national firm and that they'll deliver the same level of care for less cost to the hospital. And yet doctors we've interviewed have never heard of Emergence.
I had never heard of them. And I'm pretty familiar with all the national groups.
Neither has Dr. Jirish Yoshi with the Texas Society of Anesthesiologists.
I have never heard of this group called Emergence. I asked around and could not find anyone else who had heard of them either.
It's an important point. After all, if Emergence is expected to deliver the same level of care as the group they're replacing, knowing who they are would be a good start. And we finally did find them here in the Medicare and Medicaid Center's National Provider Registry. It's not Emergence, it's Emergence Health, one long word. Their owner, a Dr. Jeffrey Link. Link confirmed the contract with Spohn, but not much else. And he's not an anesthesiologist, he's a pulmonary critical care doctor. He doesn't live in Corpus Christi, he lives in Dallas. EmergenceHealth.com, it's under construction. And the primary practice address is not a hospital, it's someone's home. Not just that, but their Medicare-Medicaid ID number is brand new. It was assigned in September, not something you'd expect of a national firm.
And I was kind of surprised that they were elusive with respect to who this group is.
Dr. Link did tell us that Emergence is ready to bring the same level of care as before and that nothing will change. They're going to offer a team-based approach to anesthesia like always. What that means is doctors working with a team of CRNAs on every case. So who are the MDs and who are the CRNAs that make up the Emergence team? Spohn won't say, but based on some of the online job postings that we've found, Emergence is still looking for some of them. The Spohn memo says they hope to bring as many local providers as possible under Emergence, begging the question why they made the change in the first place. These emails between 6 Investigates and Spohn detail our many requests for interviews, information, and details. All that were met with the same basic response about how excited Spohn is to be working with their new anesthesia provider, and they don't have anything else to add about the announcement. And our request to interview Spohn President Justin Doss was ignored. Makes us wonder if it's just nobody's business who Spohn does business with. Dr. Peterson says absolutely not. That's because Spohn isn't just a tiny clinic, they're a giant hospital. And they're not making a business decision, they're making a healthcare decision. And since it's your health, you deserve to know who they're asking you to trust with your life.
I'm an anesthesiologist. I had surgery a couple of weeks ago, and I made sure I knew who my anesthesiologist was that was going to take care of me.
Rick Spohn, 6 Investigates.
All right, so in the interest of transparency, all of our email exchanges with Spohn and that memo are on our website, christv.com.